Hello everyone. So today we will discuss about posterior uveitis. So posterior uveitis involving the choroid. um, it is actually chorioretinitis. Now understanding just this term chorioretinitis will make these all symptoms which are seen in posterior uveitis very easy. So actually the choroid, the choriocapillaries present in the choroid, they supply the outer part of retina. So finally, whenever choroid is involved, the outer part of retina will be involved simultaneously. So whenever there will be choroiditis, we will have a retinitis involving the outer layers of retina. So this is important to understand that choroiditis will lead to retinitis. So we will consider a chorioretinitis as a feature of posterior uveitis. So next, going into its symptoms, we see that in posterior uveitis, uh, we we don't feel pain. And posterior uveitis is a painless condition, means the patient will not have pain, but actually the patient will present mainly with visual symptoms. Now if this choroid, the peripheral choroid is involved, the vision will not be obscured, means this will be an incidental finding on fundus examination. Whereas if patient has a central patch on the choroid, he will present directly with visual symptoms which will vary from mild to severe. Okay, so and let's try to understand these visual symptoms. So he will have a defective vision. Now this defective vision can be due to vitreous haze, okay, or directly due to a choroiditis. Okay, so defective vision can be due to vitreous haze that has occurred due to inflammation, or directly due to choroiditis involving our posterior part of the choroid. Okay, the second feature is photopsia. Now let's try to understand this. Actually the choroid, we know that the choroid is supplying the outer part of retina. This outer part of retina includes the retinal pigment epithelium and the layer of rods and cones. So because the nourishment to rods and cones is suffering, so the rods and cones will be irritated. This leads to flashes of light in front of eye. That is what is photopsia. The black spots floating are actually the vitreous exudate that have occurred due to inflammation. This is a schematic diagram showing the posterior part of our. This is actually completely a schematic diagram. So uh, please don't mind it. So this is the posterior part of our uh, choroid. Okay, and this is what we are seeing as inflammation, and this part of our choroid has just bumped in. Okay, it has bumped in. It should be like this, but it has bumped in. Okay, so we have the defective vision, we know the cause. Photopsia, we know the cause. Black spots floating were due to vitreous exudate, which were a byproduct of inflammation. Metamorphosia. Now metamorphosia is distortion of image. This is because of this elevation that has occurred in choroid. The image that we are perceiving, because of these ray of light, will reach here. These ray of light will reach at different angles, so this leads to metamorphosia. You may see this image, this will makes the thing clear. Okay, this is what is metamorphosia. Now let's understand the next sign, that is micropsia and macropsia. Micropsia means a big perception of a smaller image, and macropsia means perception of a large image. Now what happens is that when there occurs an elevation of choroid, along with it the rods and cones configuration is altered. uh, Consider this, these are the rods and cones. Okay, so here in the elevated part, these rods and cones will be far apart because of this elevation, whereas in the periphery these will be more closer. So where these are more closer, there occurs macropsia, and where these are far apart in the elevated part, there occurs micropsia. And the final symptom that we see is a positive scotoma. That patient will complain of a central black spot in his visual field. Okay, so these are the 6 symptoms, signs, which are very clear, which should be very clear to you. If not, please rewind again and these will become clear. Okay, so defective vision, photopsia, black spots floating, metamorphosia, micropsia and macropsia, and positive scotoma. Now let's look on to features of patch of a choroiditis. So here we are looking into an image of an active patch on the left side and a healed patch on the right side. So this active patch, what we are seeing is that this active patch, there is a pale dirty white patch you may see, okay, and there is no boundary, so irregularly it is an irregular shape, okay, pale and dirty white. And because it is there is a retinal edema, we are unable to see the choroidal vessels, okay. These are the feature of active patch of a choroiditis. Whereas when we look onto a healed patch, you are seeing on the right side, okay, this is a case of multifocal healed patch. So you are seeing satellite lesion and a lot of lesion. In this healed patch you will see some white patches, okay. So these white patches are because that the choroid has atrophied, and now we are seeing clear sclera through it, means white sclera through it. And at periphery of these white white scars, okay, these healed scars, we are seeing a black spots, okay. This is the feature of healed patch of choroiditis. Okay, next let's go on to the other types of choroiditis, clinical types of choroiditis. So choroiditis may be focal, means there is a central lesion that is focal present in macula, and there may be small satellite lesions. So there is nothing to just explain in this, you can just read it, okay, by pausing the video. The other case of multifocal and diffuse is the same, that it occurs in TB and syphilis more commonly, okay. In the treatment of this posterior uveitis, we go for systemic steroids and the uh, periocular steroids. As in the case of intermediate uveitis, we can go for immunosuppressive agents, and later on we can go for specific treatment if the cause is known. This is what is posterior uveitis. Thanks for watching.